Are you about to be put on medication for your anxiety or OCD, or are you considering it? We're going to talk all about it. Stay tuned. That's what's up next. Hi, my name is Natasha Daniels. I'm a therapist and make videos for people with anxiety or OCD. And today we're going to talk to you about anxiety or OCD medication. A lot of times people have questions about this. What is it for? Why am I being prescribed it? What does it mean for me? And so I want to answer some of those basic questions so that you can feel more comfortable with the decision or with what is happening to you. So a lot of times anxiety and OCD is too overwhelming for people to handle on their own. There is a physiological response that's going on in your body, and sometimes we need medication to help with that. So just like if you had diabetes and your pancreas wasn't metabolizing sugar the way that it should, you might have to take insulin or medication to help with that. But it's also important to watch your diet, to maintain your sugar levels, and do a lot of behavioral things to keep yourself in check. And the same thing goes with anxiety or OCD. We're dealing with neurotransmitters, which is a physiological issue in your body. And you can have all the courage and motivation in the world to work on your anxiety or OCD, but if your anxiety or OCD is just so overwhelming, you're either having so many physical responses, your stomach hurts, you're nauseous, or the idea of going over that cliff and pushing yourself into discomfort or doing anything that means that you're going to walk towards your fears is just way, way, way too overwhelming, you might need some medication to help with that. Because the way that we beat anxiety or OCD is we move towards the discomfort, and we rewire our brain by training our brain that it is okay. We're getting all these signals in our body that say, oh my gosh, this is an emergency, we cannot do that, or this is really scary. It's different for each person. But we have to ignore all that noise in our head and do those things anyway. And we do that with things like exposure with response prevention, ERP, which is really the gold standard treatment for anxiety or OCD. But a lot of times people can't do those things, not because they don't want to, but because the noise in their head and that emergency response in your body is way too loud. So it's like asking someone to walk off a cliff and them not really being sure that a parachute is going to pop out, and the fear is way too great for them to make that next move. And so for some people with anxiety and OCD, medication is needed, and medication is super helpful. So just like that child who needs to take insulin to control their diabetes, the same is true for a lot of people with anxiety or OCD. It doesn't mean you're weak. It doesn't mean there's something wrong with you. It just means that you need that help with your neurotransmitters to be able to do the work that you need to do in order to get some relief. Medication is not the only answer. Medication is one component. It's one piece of the puzzle. You're going to have to show up as well and do your work. It's like training wheels. It's trying to give you that cushion so that you can start to ride and pedal and get your momentum and get going without feeling like you're so imbalanced that you are afraid to even start the pedal. So you want to look at therapy or doing your work and medication as a team approach. So what happens when you get prescribed medication? Now, a lot of times people think it's going to drastically change their personality. They think they're going to be a totally different person. They think that it's going to squash their artistic abilities or their creativity or who they are as a person as far as being outgoing or funny. And really, medication for anxiety or OCD doesn't really do that. In fact, a lot of people don't feel any difference at all. And the only difference is often subtle, where they just feel like, it's not that big of a deal if I do that little thing out of my comfort zone. Or all this noise in my head is just getting quieter so that I can feel like I can make the next step. So you don't see drastic personality changes with medications for anxiety or OCD typically. You just see subtle differences. And a lot of times people are disappointed and they're like, I don't feel any different. And my answer is, you're not supposed to feel any different. You're just supposed to feel empowered that you can take those next steps and do those challenges to squash your anxiety or OCD. So the important thing to know, a couple of important things. One is there's a lot of different anxiety and OCD medications, and they impact you in different ways, and some are really good and some don't work that well. And so you might start on one medication and they're going to try it, and then they might move you to a different medication. And so there is a little bit of trial and error with medications when it comes to anxiety or OCD, and that's totally normal. That's part of the process. The other thing is it builds up over time. So it's not like an aspirin where you take medication and then your headache goes away. It builds up in your bloodstream over a period of weeks and months. And so some people see progress right away within the first week, but more often than not, people see progress in the weeks and months to come because it builds up. So you need to take it every day, you need to take it consistently, and you need to be patient and do your work. Often I start to see people showing up in therapy and doing braver things and not even recognizing that they're making any changes. I'll be like, oh my gosh, I can't believe you're willing to do that. You know, a month ago, you would never have done that challenge. And they'll be like, really? And I'm like, yeah, you wouldn't. And so sometimes the changes are so subtle that people around you start to notice them before you even notice them. And the other thing is, often a psychiatrist or psychiatric nurse practitioner will prescribe something small and they'll increase the medication dosage over time. And they're doing that because they want to make sure that your body gets used to it, that you get used to it, and that you're okay with it as they move up. So that's normal as well. The people that prescribe medication are psychiatrists, like I said, or psychiatric nurse practitioners. Your therapist typically does not prescribe medication. I'm a therapist, I don't prescribe medication. It has nothing to do with me. I'm the therapist, I deal with the therapy part, and we work together. So you would go see a psychiatrist or a psychiatric nurse practitioner to prescribe your medication, to monitor your medication, and to talk to you about medication topics. And you would still continue to see your therapist to get your therapy, to reframe your thinking, or to do exposures and challenges, and to face your fears one slow step at a time. So it's important to know that both of those pieces are still going to happen. And the last thing I want to mention is that unlike the child or adult who has diabetes, they can't change their pancreas, right? They have to take medication, and medication will help them. They have to watch their diet and what they're eating, and that's how they're going to manage their diabetes. The cool thing about having anxiety or OCD, which there are some cool things, there are some superpowers, that's not about this video, but there are some personality traits that I think are pretty awesome that come with anxiety and OCD. But the silver lining when it comes to anxiety and OCD is that there's something called neuroplasticity. And neuroplasticity means that you can actually rewire your brain. You can change your neural pathways. You can shrink anxiety and OCD. You can grow it. You can do these things through your behaviors and your actions. So when we give in to anxiety and OCD, we're growing those neural pathways. We're growing highways in our brain that are making the anxiety or OCD stronger. And when we ignore anxiety and OCD, we don't avoid our fears. If we have OCD, we're not doing our compulsions, or we're starting to try to ignore them or delay them. We are shrinking those neural pathways, and we're making anxiety or OCD weaker. So we literally have the power to do something similar to what medication is doing. It's just that sometimes we need the medication to help with that. But the beautiful thing is when you get medication and you get your therapy, or you don't have to have therapy, but you're doing exposures, you're doing hard things, and you put them together, that's super powerful, because then you're really, really changing your brain from both avenues, which can make a big difference. So I think that's inspiring to know that we have the power to change our brain through our behaviors. And sometimes the anxiety or OCD is just too strong, too loud, and too overwhelming to do that because it's paralyzing. And that's not a you problem, that's a physiological problem, and that is easily fixed. Many, many, many people are on anxiety and OCD medications. It is very common, it is often prescribed, and people have a lot of success and progress on medication. So it's nothing to feel ashamed about, embarrassed about. And there's a lot of misinformation about it. So you want to make sure that you get the right information, because it's not about being a zombie, it's not about being addicted. You can't get addicted to anxiety or OCD medications. It's non-addictive. You don't have to be on it forever. And so talk to your psychiatrist or your psychiatric nurse practitioner about these myths that you are concerned with so that you get the proper information, the right information that is important for you to know before you begin. So I hope that you found this video helpful. I hope you find the sparkle in everything you do, and I'll talk to you again next Thursday. Take care.